My name's Drew Washer. I'm a licensed clinical social worker. I work here at French Hospital. I've been here for about 25 years now, and I work with patients who are in the hospital and working on plans of how to get them back home and help them get hooked up with resources and things like that. You know, over the years, the last 10 to 12 years, we've seen an increased number of people who are homeless and who are also medically fragile. And what I mean by medically fragile is that's people who come in with chronic health issues that need more than just a quick day or two in the hospital, and they can't go back to the homeless shelter and they can't go back to the streets. And the hospital really felt a need that we had to have a place to send patients that they could recover and they could have a place where they could heal and feel safe. So that's kind of what we started with this program. When Anthony came into the hospital, he was at the homeless shelter, and he had been at the homeless shelter for some time. And at this point, when he came to us, he had this serious infection, and it was really not safe for him to go back to a shelter where he really couldn't get the care he needed. So at this point, that's when we decided Anthony needed more than going back to the shelter, but he needed to go into an apartment where we could provide ongoing medical services for his care. So we had our apartment at the Anderson Hotel, and it's it's run by the Housing Authority, and it's a hotel in downtown San Luis Obispo. It's a great place that we really feel safe in discharging our patients to. So we knew that when Anthony went there, he could get the medical services and also have the support he needed to do his recovery.
What it has offered me here is a solid roof over my head, a nice bed to sleep in, and they serve a lunch here every day, so there's a meal. And as you can see, looking around, the dresser, the refrigerator, the coffee pot, the Anderson has really made it comfortable for me in the times that I need it here.
Anthony is a very gentleman. He is a person who I find is very appreciative. And has a lot of integrity, who I really felt is in a terrible predicament with being homeless. So Anthony is a person I feel, we really want to try to help. He really deserves to have a place in this world where he could call his own.
If the program through the French Hospital had not been available, I really wonder where I would be. They gave me good treatment. It was needed. If it hadn't been there, I honestly don't know if I'd be here today.
When I first heard the term, human kindness here at the hospital, it really meant to me that we're really looking at the person more than just, as a patient. We're looking at the whole person. And to me, that really is gratifying, being a medical social worker, working in a medical setting, that we're looking at more than just a patient, a diagnosis. We're looking at the whole person.